Welcome to the Inside Scope, a Lakeland Regional Health podcast that gives you the inside scoop on today's most popular health topics, straight from the experts themselves. I'm your host, Dr. Daniel Haight, Vice President of Community Health at LRH. On today's episode, I am joined by Dr. Fred Blind. As a board-certified emergency department medical director here at LRH, Dr. Blind has an extensive background in emergency medicine and completed his residency at the University of Florida College of Medicine at Jacksonville. We are pleased to have him on the podcast today to talk about emergency care in our community. Let's get started.
I never want to think about going to an emergency room, and at some point I would worry, would I know exactly where to go? Sometimes a neighbor of mine said they didn't know where to go, but they had a near miss where they thought they were headed to an emergency room. They found out where to go, and then they didn't have to go. So now they know. Yep. But that's a big concern, is like, well, where to go and why should I go? Tell me a little bit about that.
Yeah, I think it's hard for the patient because there's a lot of options in healthcare right now. There's a lot of places that you can go when you're trying to get care. And one of the best resources for it is your primary care physician, especially if it's daytime hours. You can call them most of the time. They have somebody at the front desk. You can tell them what's going on. They can kind of help you. Sometimes with your insurance, you can reach out to them as well, and they may be able to give you some guidance. But there's a whole spectrum of caring for the patient.
So starting with primary care, and I've always heard that primary care, the doctor or nurse practitioner you see, that's really your healthcare home.
They are.
They know the most about you. And they ask you a lot of questions when they first meet you. They'll ask you, did you have your appendix out? And you're like, well, why are you asking me that?
Yep.
Well, maybe a year from now, you'll have belly pain.
Yep.
I know you.
Yep.
Because I've sat down and talked to you. So you're recommending get to know your primary care doctor.
Absolutely.
That's your healthcare home.
I think they're the best quarterback to reach out to first. You know, sometimes there are things in life that you don't have the opportunity. You get in a car accident, those type of things, and the decision's not yours. It's EMS on where they're taking you. But for those times that you can, I certainly think reaching out to the provider that knows you the best is the best place to start.
Perfect. And now, I think we have a lot of components of just, common sense. If I had this is where I would go and call. What's your advice on how do I choose where to go?
So I think it's kind of hard sometimes. It kind of depends on what's going on that you need a medical care for. It's sometimes easy if you fall and your arm's deformed, you need an emergency room. But there's other ends of the spectrum too. Maybe you have a cough or cold, or your allergies are starting to flare up, those type of things. So there's this big spectrum, and I think that's those type of things, reaching out to your primary first and saying, is this something you guys can get me in for? If not, possibly an urgent care. I think, you got to kind of, use the resources that you have, and the best one that you have is your primary care physician.
I like how understanding y'all are at in the emergency department, because the patients you're seeing have probably already received a ton of advice. Yep. They've had Aunt Susie say this, the neighbor said that, coworker said you should do this, and it's all these you should. You've got to get to an expert and someone that can sit down and ask, well, what matters most to you? How can I help you? And then spend a lot of time listening.
Yep.
How do you feel? What is the most important thing to you as an ER doctor?
Yeah, so ER doctors, primary care is trained to manage your health conditions and stuff, and urgent care is trained to take care of some of the more minor emergencies and stuff. For the emergency room physician, we're looking for those life-threatening things and stuff. And so when you come in with belly pain, we're thinking about the bad things and stuff that can cause pain.
And I might not even know that my belly pain, and I know sometimes, and I'll ask a little bit later, is that something you might think is nausea could be your heart telling you that. And it's really, sometimes it's just your stomach, but sometimes it could be more serious.
Yep. And so the ER doctor is going to spend a lot of time trying to, with their history and their physical exam, trying to go through and think about those high-risk conditions that we do not want to miss for you, the patient, and kind of, see if you need further testing for those type of things, or to your point, is this just nausea and stuff? So a lot of the time spent in the room is kind of trying to get down to the basis of what is the emergency here and what do we really need to make sure that we're not missing.
That's what I like talking about. When I talk to high school students about careers, and we just don't talk about healthcare careers, we talk about law enforcement, we talk about banking. It's when you get to know somebody, it's amazing that you as physicians and law enforcement and others, they have a series of questions to get to the bottom of what's going on. It's not just as simple as tell me where it hurts.
Oh,
I
absolutely.
mean, you must ask a ton of questions to try to sort quickly through, is this life-threatening?
Yep.
Or is it not? What are some of those questions you ask?
So, I mean, you're going to talk about, when did this start? Well, tell me about the nature of the pain. Does the pain radiate? Is there things that make it better? Are there things that make it worse?
Those are all clues.
Yep.
Yeah. So when you start hearing that,
Yep.
That's what the other thing I'd advise is if you're going to the doctor, the urgent care, or the emergency department, be ready. If you're a family member,
Yep.
you can predict the questions you're going to be asked.
Well,
And, right?
Yeah, well, I think one of the biggest things, especially as a family member or patient when you go to the ER, is bringing a med list. That you
the
have with you.
medications.
Yeah, because it's it's a high stress environment. You're scared and stuff about what's going on.
And I can forget something.
Yeah, knowing what meds that you're on and having a list that you keep in your wallet or those type of things can be hugely impactful to the person taking care of you.
Because just myself and my own experience is like, well, let me make sure I remember everything. This problem started on this date. This is when it happens. This is what makes it worse. This is what makes it better. This is what it feels like. It's sharp and stabbing. Or is it really burning? Or is it throbbing? And those are the clues.
Absolutely.
That you go through.
I think also too, like, you initially see the emergency department, physician, and they come in, they take this history, they spend time with you. If they leave the room and you think of other things that you think they need to know, like, please don't be shy. Call them back to the room, because the more information you can provide, the better they are at doing their job.
I like some rooms have those whiteboards in it,
Yes.
and I'll tell the family, you write on the right board, because you'll have a doctor come in and you'll say, I forgot. No, it's on the whiteboard. We wrote down, what is the most important thing going on right now? Because there could be 3 things happening at once, and it's like, I want to know, what do you think is the most important, and why, and what are we going to do about it? Well, that's what I think is exciting about the emergency rooms. And I think our emergency rooms now, they're giving more options geographically and some service understandings of what you find there. So you have the main emergency room at Lakeland Regional. What are some other options we have?
So there's the main emergency department, which takes care of adults. There is the fast track department that also takes care of adults. And it functions similar to like an urgent care for those type of complaints, for those patients that came to the emergency room but maybe have more of like an urgent care, complaint. There's the pediatric emergency department there at Lakeland Regional, and that is the only peds emergency department in Polk County.
Right there at the hospital. That's the
Correct.
only dedicated pediatric. Wow, okay.
Yep. And then we just recently opened our freestanding emergency department on South Florida, and that is a fully functional emergency department, just not attached to the hospital.
And that's 24 hours a day?
24 hours a day, 7 days a week.
365 days?
Always.
So you have that basically a recreation of a full-fledged emergency department there on South Florida Avenue and 540A. And that is, well, tell me about that. Like, how large is it? What kind of services are provided there?
Yeah, so basically anything that you would present to an emergency department for, we can take care of there. Now, granted, if you come in as a trauma alert, those type of things, we try to direct those to the main hospital because we want you there with the trauma surgeons and everything else as well. But for a private individual coming in, we have everything there that we'd need. We have x-ray capabilities, ultrasound, CT scan, medications. We have all the things for your orthopedic care, for airway management. In the event that you needed advanced airway medicine, we have all of those type of things there. We see pediatrics. My last shift there, my youngest patient was 28 days. My oldest patient was 98. Wow. So it's the full spectrum of care that you're seeing there.
What I also loved what you described was this team behind you. I mean, when you talked about medications, I'm thinking you have someone that's the pharmacy techs that know how to do it. You have radiology techs, the nurses that are there, the triage. So this is really a huge team effort that's coming together to provide services.
Oh, absolutely. One of the biggest things on the team there, too, that Lakeland Health did a very good job with is they put a fully functional lab there. So the same type of things that we would have a lab specialist running here at the main hospital, we can run there at the freestanding emergency department with the same accuracy that we would have at the main hospital.
Oh, excellent. Well, the question does come up still. I'm not feeling good. Something's going on. Should I go to the emergency room? Well, you've already described if it's not a full-fledged, obvious emergency, contact your primary care doctor. They're your healthcare home. They have all the information about you, and you and I were talking earlier, they're connected with the other doctors at Lakeland Regional, whether it's the emergency department or urgent care. So that's a good starting place.
Yep.
But then it's like, I want to decide where to go. Let me run by. I'm going to give you a little quiz. Okay,
All right, sounds good.
So we're going to see, well, what would you do in this situation? And some of you may say, oh, that might be my relative or my neighbor. All right, so let's start. Number 1, blurry vision, feeling tired, always thirsty. I'm peeing a lot, and my toes feel like pins and needles, especially at night. It's bugging me. I want to get care. Where should I go?
So for that type of complaint, you could ultimately go to your primary care physician. But if you're starting to get to the point that you're getting very weak, you're getting lightheaded, those type of things, I would say go to an emergency department. You're likely in the early onsets of diabetes or even advanced, and you can get health conditions like diabetic ketoacidosis that get very advanced very quickly when you don't have the medications that you need.
And you took the mystery out of it. You nailed it. That was diabetes. So I'm sorry, you're the expert on this. But you brought up a good point. It was the context. If you're feeling tired in a mild sort of way,
Yep.
you could see where you might want to go to. But if you're so tired you can't do things like get dressed, or you just are not getting out, you're not getting out of bed, and you're so thirsty, your vision's so blurred, this onset of diabetes would be it.
And the reason I'd say go to an ER for those type of things, your primary care physician can certainly do labs and stuff on you, but the turnaround for those labs is not going to come back as quickly as in an emergency department, where you're going to have your results in an hour and a half, and they have all the medications to start kind of correcting the issue.
And the worsening of diabetes, you might be having the need for more severe care. So if you have, this is number 2, vision on one side is gone. I can't seem to speak right. I can't find the right word, and I'm dropping things from one hand.
Yeah, so obviously this is a concerning story for something going on in your brain, potentially a stroke. Those are the type of things you worry about there. Those ones, I would go directly to the emergency department. We have a time window when it comes to stroke, and the earlier you can present to the emergency department, there's more things that we can do for you, but ultimately you need to get there quickly.
It's like a brain attack, same as like a heart attack. Brain attack, every second counts?
Every second counts.
All right, here's number 3. Bug bites on my legs. They're so itchy, I can't sleep.
Yeah, so this is, if it's me and I've been out and I've got mosquito bites all over me and I just cannot go to bed and stuff, like this is the type of thing where you may want to think about an urgent care. So they can do different medications or IM injections and stuff to try to get you quicker relief. You could certainly go to your primary care physician as well if you can tolerate it and stuff and can kind of make the appointment and get in quickly. But sometimes you just need care right then and there, and that's the type of thing that I think is the perfect complaint for like an urgent care.
Excellent. And I think there are just these common things out there that we stop and we wonder, but we really ask ourselves, is this really impairing what I want to do? But then there's those things that they're dangerous, but you may not know they're dangerous. The one where a woman in her 50s, she has a little high blood pressure. It's well controlled, but she's noticing nausea every time she goes up a flight of stairs or does something exertional. The nausea gets better when she rests. Thinks it's maybe just indigestion. Yep. What's your thoughts on that one?
So those ones are kind of hard, especially if those symptoms are getting worse and worse and stuff throughout the week and you're noticing them, and maybe you're starting to have that kind of nausea and that weakness and stuff at times where you're not exerting yourself. Those are those type of things we worry about, especially in women, as this being your heart.
Number one killer of women
is
a heart disease, and it's different, right?
And unfortunately, women don't read the textbook when it comes to your heart. Dr. Haight, if you're having a heart attack, it's going to be an elephant sitting on my chest, and I'm all
going down my left arm.
Yeah,
I always thought that the heart attack is chest pain going down my left arm, but in women, it could be something.
It can be very atypical. It can sometimes not have that kind of really extreme presentation that you'll see in other times. It certainly can as well, but you have to have a much higher index of suspicion for it. So I really think in that scenario, I would pursue more emergency care for it.
And I know a common one out there for parents is my kid's got a high fever.
Absolutely. And it's scary. I mean, I'm a parent. I've got 2 beautiful girls. And when they get sick, you want to do everything that you can. I think a lot of times in pediatrics, it comes down to how is your child acting? So if they're
their behavior, right?
Yeah. If they're still like running around playful, their fever comes down, they're acting just like they normally act, I would call your pediatrician and try and schedule an appointment or go to the urgent care for them. If it's something, though, that you just cannot console them, they're crying all the time, they're not eating, they're not drinking, you notice that they're not, if they're diaper age, they're not making as many wet diapers, you need an emergency room.
They're getting dehydrated.
Yeah.
And I think that's where we know our own bodies. We know those closest to us. We know our own kids, and we see that that helps us in that decision making, that gut. And I think that's when ER doctors, you know that you're listening to the friends and relatives, and you might have the patient saying one thing, and the spouse is behind them shaking their head.
Oh,
going,
absolutely.
I know the truth
Every day.
So that helps a bit. But it is so wonderful to have you in the community. You're applying your expertise in a team fashion. Plus, you're communicating back to that primary care doctor. I always say, make sure that patient they're telling their primary care that they were in the emergency room, so that they can see what happens next to keep you from getting sick again.
Yeah, absolutely, because they are truly the quarterback of your healthcare. And so you want them involved kind of every step of the way. And sometimes when you're in the hospital, we can try and communicate with them, those type of things. But you need to also, and they're going to get your records and all those, but you need to be able to tell them your story and stuff as well, because your healthcare doesn't stop when you leave the hospital.
Right.
That's the time where you need to make
it's
those changes.
It's not one and done. You go into the emergency room,
Absolutely.
one and done. Not, you need to have it followed up. But I love that. The new emergency room on 540A and South Florida, it's so large and spacious. You can really see the healing occurring. It's something where you see the team working together. It's the flow of it goes smoothly, and I really appreciate how efficient y'all are and just being able to take care of our community.
No, we love the opportunity to practice there and bring what Lakeland Health offers to that area a lot more and at a lot higher capability. And one of the great things about that is when you're seen there, you have the whole team of Lakeland Health behind you. So whether it's orthopedic care or ENT or, coordinating with your primary care physician and specialist, you have that whole team behind you to kind of facilitate that care after you leave the ED.
And plus, I think you've just received certification of being age-friendly, which means you've gone through a lot to say, as we get older, what makes the experience take into account things that change as we get older? Hearing, eyesight, if there's things that, the family needs when taking care of an older adult.
Absolutely.
And coming in. So you have that age-friendly status. I really appreciate that, because I know I'm really into the what matters most as we age. And that we start to sort out mobility, mentation, medications.
Yeah, our geriatric certification that we have, there was a lot of steps to go through, but it's much more of a holistic experience, for those patients that have aged and stuff, because you're absolutely right. There's more things you have to consider. The medications that you're giving, what's their access to care, what family members, fall precautions, how are they going to do their activities of daily living. There's a lot that goes into caring for, different age populations, just the same way there's a lot that goes into caring for pediatrics.
Exactly, and I just think we're in such good hands. Well, thank you and Lakeland Regional Health and their emergency department and the different locations that are coming up. We're going to learn more in the future about our urgent care, bring you back to talk about, again, the synergy between the primary care, the emergency department, the hospital. We could get into that later, too, to say, what if you need even further care? And then getting back to that primary care is going to be there with you all the way. Thanks again for everything you're doing.
Absolutely. Thank you for having me.
Excellent.